Imagine waking up every morning feeling exhausted despite having a full night's sleep. You notice your vision isn't as sharp as it used to be, and there's this persistent thirst that just won't go away. Could these seemingly unrelated issues be your body's way of signaling a deeper problem? Today, we're diving deep into understanding how our bodies communicate elevated blood sugar levels and uncovering the hidden signs you should never ignore. Glucose is the essential fuel that powers every cell in our body. Derived from the foods we consume, particularly carbohydrates, it provides the energy needed for our organs and systems to function optimally. But like any fuel, balance is key. Too little, and our bodies struggle to perform basic tasks. Too much, and we set the stage for a myriad of health complications. Insulin, a hormone produced by the pancreas, acts as the gatekeeper, allowing glucose to enter our cells and be utilized effectively. When this delicate balance between glucose and insulin is disrupted, glucose begins to accumulate in the bloodstream, leading to what is known as hyperglycemia or high blood sugar. While occasional spikes can occur after a heavy meal or due to stress, consistently elevated blood sugar levels can be a precursor to more serious conditions like diabetes. But how do we know when our blood sugar is too high? Our bodies are incredibly adept at sending signals, but it's up to us to recognize and interpret them. Let's explore 7 crucial signs that your blood sugar might be higher than it should be and delve into 5 additional symptoms that could indicate the onset of diabetes. Sign number 1. Excessive urination. Have you found yourself making frequent trips to the bathroom, especially during the night? This isn't just an inconvenience, it's your body's urgent call for help. When blood sugar levels soar, the kidneys strive to filter and absorb the excess glucose. However, when they can't keep up, the body resorts to flushing it out through urine. This process pulls additional fluids from your tissues, leading to increased urination, a condition medically known as polyuria. This excessive loss of fluids doesn't just stop at frequent bathroom visits. It can also pave the way for urinary tract infections. According to research published in the Journal of Urology in the year 2014, individuals with elevated blood sugar levels are more susceptible to such infections due to the sugar-rich environment fostering bacterial growth. These infections can cause discomfort, pain during urination, and even more serious kidney issues if left untreated. Recognizing this sign early can help you take proactive steps to manage your blood sugar and prevent further complications. If you're noticing that your bathroom visits have increased without any obvious reason, it's time to pay attention and consult a healthcare professional. Sign number 2. Unexplained weight gain. Gaining weight without significant changes in your diet or exercise routine can be puzzling and frustrating. While many factors can contribute to weight gain, consistently high blood sugar levels play a significant role. When there's too much glucose in the bloodstream, and insulin isn't effectively transporting it into the cells, the body starts converting this excess glucose into fat, particularly around the abdomen. A study published in the Journal of Clinical Nutrition in the year 2010 highlighted that insulin resistance, a condition where the body's cells don't respond properly to insulin, leads to increased fat storage and weight gain. This creates a vicious cycle where additional weight further exacerbates insulin resistance, making it even harder to regulate blood sugar levels. Moreover, this type of weight gain isn't just about aesthetics. It's a major risk factor for developing type 2 diabetes and cardiovascular diseases. Keeping an eye on unexpected changes in your weight and body composition is crucial. Incorporating balanced nutrition and regular physical activity can help manage weight and improve insulin sensitivity, breaking the cycle before it leads to more serious health issues. Sign number 3. Persistent and unquenchable thirst. Imagine drinking glass after glass of water, yet still feeling parched. This insatiable thirst, known as polydipsia, is another telltale sign of high blood sugar. As previously mentioned, when excess glucose is expelled through urine, it drags significant amounts of water with it, leading to dehydration. Your body responds by triggering thirst signals, urging you to replenish the lost fluids. But it's not just about feeling thirsty. This dehydration can lead to dry mouth, chapped lips, and even dry, itchy skin. In severe cases, prolonged dehydration affects overall health, leading to dizziness, weakness, and impaired cognitive functions. According to a study in the Journal of Endocrinology and Metabolism conducted in the year 2012, chronic dehydration resulting from persistent high blood sugar can strain the kidneys and cardiovascular system, increasing the risk of kidney disease and hypertension. If you notice that your thirst levels are unusually high and don't subside despite adequate fluid intake, it's essential to investigate further. Monitoring your blood sugar levels and seeking medical advice can help address the underlying cause and restore your body's fluid balance. Sign number 4. Blurred and impaired vision. Suddenly struggling to see things clearly? Blurred vision isn't always about needing new glasses. It can be a significant indicator of elevated blood sugar levels. High glucose levels cause the lenses in your eyes to swell, altering their shape and affecting your ability to focus properly. This symptom can be transient, improving as blood sugar levels normalize, but consistent high levels pose a more serious threat. The American Journal of Ophthalmology published findings in the year 2015 indicating that prolonged hyperglycemia damages the tiny blood vessels in the retina, leading to diabetic retinopathy, a leading cause of blindness among adults. Early stages of vision impairment may include difficulty reading, seeing distant objects, or distinguishing colors. If left unchecked, this damage can progress, leading to vision loss. Regular eye examinations and controlling blood sugar levels are critical in preventing and managing such complications. So, if your world starts to look a bit hazy, don't just brush it off. It could be your body's way of signaling an urgent need for attention. Sign number 5. Frequent infections and slow-healing wounds. Our body's ability to fight off infections and heal wounds is a remarkable process, but elevated blood sugar levels can significantly hamper this natural defense mechanism. High glucose levels create an ideal environment for bacteria and fungi to thrive, leading to frequent infections, particularly in the skin, gums, and urinary tract. Moreover, the body's healing process slows down considerably. A simple cut or bruise that would typically heal swiftly may linger, becoming a persistent and sometimes serious issue. Research published in the Journal of Wound Care in the year 2016 demonstrated that hyperglycemia impairs the function of white blood cells, crucial players in fighting infections and facilitating healing. Additionally, poor circulation resulting from damaged blood vessels means less oxygen and nutrients reach the wound site, further delaying recovery. These slow-healing wounds are not just inconvenient, they can escalate into severe infections and ulcers, particularly in the feet, leading to complications that may require medical intervention or even surgery. Paying close attention to how your body heals and responds to minor injuries can provide critical insights into your blood sugar health. Sign number 6. Unrelenting fatigue and weakness. We all experience tiredness from time to time, but what if you feel exhausted even after a restful night? Persistent fatigue is a common and often overlooked sign of high blood sugar. When insulin isn't functioning properly and glucose can't enter the cells effectively, your body is deprived of its primary energy source, leaving you feeling drained and lethargic. This lack of energy impacts not only physical activities, but also mental functions. Concentration becomes difficult, productivity dwindles, and even simple daily tasks feel overwhelming. According to a study in the Journal of Diabetes Research in the year 2013, individuals with elevated blood sugar levels reported significantly higher levels of fatigue and decreased quality of life compared to those with normal levels. Furthermore, frequent urination and dehydration associated with high blood sugar can disrupt sleep patterns, compounding feelings of exhaustion. If you find that rest doesn't alleviate your tiredness and you're constantly battling fatigue, it might be time to evaluate your blood sugar levels and consult with a healthcare provider for proper assessment and guidance. Sign number 7. Digestive issues and abdominal discomfort. Your gut is often referred to as your second brain, and when something is off, it communicates through discomfort and digestive disturbances. High blood sugar levels can lead to a range of gastrointestinal issues, including abdominal pain, bloating, nausea, and even vomiting. This occurs because excessive glucose affects the normal functioning of the digestive system, slowing down the process and leading to discomfort. Additionally, high blood sugar can damage the nerves that control the digestive tract, a condition known as gastroparesis, where the stomach takes too long to empty its contents. The Journal of Gastroenterology published a study in the year 2011 linking prolonged hyperglycemia to increased incidence of such digestive disorders. These digestive issues not only cause immediate discomfort, but can also lead to malnutrition and unintended weight loss over time. Monitoring and managing blood sugar levels play a crucial role in maintaining a healthy digestive system and overall well-being. Now that we've explored the 7 critical signs indicating high blood sugar levels, it's essential to understand that these symptoms can also be early warning signs of diabetes, a chronic condition affecting millions worldwide. Let's delve into 5 specific symptoms that could signal the onset of diabetes, empowering you with knowledge to take timely action. Diabetes symptom number 1. Constant and intense hunger. Feeling hungry shortly after a meal and experiencing intense cravings throughout the day? This could be more than just a fast metabolism. In diabetes, despite high levels of glucose in the blood, the cells are starved of energy due to insufficient or ineffective insulin. This energy deprivation triggers the body to seek more fuel, leading to persistent and often insatiable hunger, known as polyphagia. A study in the Journal of Clinical Nutrition and Metabolic Care in the year 2009 found that uncontrolled blood sugar levels significantly increase appetite and cravings, particularly for sugary and carbohydrate-rich foods. Succumbing to these cravings leads to a dangerous cycle of elevated blood sugar and further insulin resistance. Recognizing and addressing this symptom is vital. Incorporating balanced meals rich in fiber, protein, and healthy fats can help stabilize blood sugar and control hunger. Consulting with healthcare professionals for appropriate dietary guidance and monitoring is also crucial in managing this symptom effectively. Diabetes. Symptom number 2. Tingling and numbness in extremities. Experiencing a persistent tingling sensation or numbness in your hands and feet? This could be a sign of diabetic neuropathy, a common complication of diabetes resulting from nerve damage caused by prolonged high blood sugar levels. The excess glucose injures the walls of tiny blood vessels that nourish the nerves, especially in the legs and feet. The Journal of Neurology published research in the year 2012 indicating that early detection and control of blood sugar levels can significantly reduce the risk and progression of neuropathy. Symptoms may start as mild tingling or burning sensations and progress to sharp pains or complete loss of sensation, increasing the risk of injuries and infections due to unnoticed wounds. Managing blood sugar levels diligently and conducting regular foot and hand examinations are essential steps in preventing and mitigating nerve damage. If you notice these sensations persistently, seeking medical evaluation promptly can lead to early intervention and better outcomes. Diabetes symptom number 3. Darkened skin patches. Have you noticed dark, velvety patches appearing on your skin, particularly around the neck, armpits, or groin? This condition, known as acanthosis nigricans, is often a warning sign of insulin resistance and can precede the development of type 2 diabetes. These skin changes occur because excess insulin in the bloodstream stimulates the growth of skin cells and melanin, leading to thickened, darker areas. A study in the Journal of Dermatology in the year 2008 emphasized that acanthosis nigricans is a significant clinical marker for assessing the risk of diabetes, especially in individuals with a family history of the condition. While the skin changes themselves aren't harmful, they indicate underlying metabolic issues that require attention. Addressing insulin resistance through lifestyle modifications such as diet and exercise and seeking medical advice can help improve both skin condition and overall health. Diabetes symptom number 4. Frequent yeast infections and persistent itching. Dealing with recurrent yeast infections and unexplained itching can be both uncomfortable and concerning. High blood sugar levels create an ideal breeding ground for yeast, particularly Candida species, leading to infections in various parts of the body, including the mouth, oral thrush, genital areas, and skin folds. The Journal of Infectious Diseases published findings in the year 2010 demonstrating a strong correlation between uncontrolled diabetes and increased incidence of fungal infections. Symptoms include redness, soreness, and persistent itching, which can significantly impact quality of life. Proper management of blood sugar levels is crucial in preventing these recurrent infections. Maintaining good hygiene, keeping skin dry, and consuming a balanced diet can also help reduce the risk. If you experience frequent infections, it's important to consult with healthcare providers for appropriate treatment and blood sugar assessment. Diabetes symptom number 5. Mood swings and irritability. Our physical health profoundly affects our mental and emotional well-being. Fluctuating and elevated blood sugar levels can lead to noticeable changes in mood, including increased irritability, sudden mood swings, and even symptoms of depression and anxiety. A study in the Journal of Behavioral Medicine in the year 2014 highlighted that individuals with poorly controlled diabetes reported higher levels of stress, frustration, and emotional instability. The body's inability to effectively utilize glucose impacts brain function and neurotransmitter balance, leading to these mood alterations. Recognizing this connection is essential for holistic health management. Ensuring stable blood sugar levels through diet, exercise, and, when necessary, medication can help maintain emotional balance. Additionally, seeking support from mental health professionals can provide strategies to cope with and manage mood-related symptoms effectively. Conclusion. Our bodies are incredible communicators, constantly sending signals to indicate when something isn't quite right. Understanding and paying attention to these signs can make a profound difference in our health outcomes. Elevated blood sugar levels and the onset of diabetes don't happen overnight. They develop gradually, offering us opportunities to intervene and restore balance. By recognizing symptoms like excessive thirst, frequent urination, unexplained weight changes, and persistent fatigue, we can take proactive steps toward better health. This includes adopting a balanced diet rich in whole foods, engaging in regular physical activity, monitoring blood sugar levels, and seeking medical guidance when necessary. Remember, early detection and intervention are key in preventing the progression of high blood sugar into full-blown diabetes and avoiding serious complications associated with the condition. Empower yourself with knowledge, listen to your body's signals, and take action to support your health and well-being. Your health journey is uniquely yours, but you don't have to walk it alone. Reach out to healthcare professionals, support groups, and loved ones as you navigate maintaining balanced blood sugar levels and overall wellness. Stay informed, stay proactive, and prioritize your health every day. If this information resonated with you, don't wait until it's too late. Take control of your health today by staying informed and proactive. Make sure to share this video with friends and family who might benefit from these insights. Together, we can spread awareness and help prevent serious health issues. For more tips and advice on managing your health, hit that subscribe button and turn on notifications so you never miss out on our latest videos. Your well-being is our top priority, and we're here to support you every step of the way. Let's take this journey to better health together.